Today, the topic of discussion we have is skin allergies in children. So, quite a good topic. And before starting our discussion, I would like to thank BabyChakra app for providing such a nice platform where we can have so much discussion and clarify our queries. This skin allergy in children is quite a confusing thing because parents are so confused, and it is one of the most common problem with which parents visit to our OPTs. So hopefully it will be a nice session. Before we start our discussion, first and foremost, I would like to make you understand what basically allergy means. If we understand what allergy is actually, then we most of our query will be resolved by them itself. Allergy is itself an autoimmune response, or rather saying an exaggerated response in an individual to some factors which are present, some environmental factors which are present in our environment, which is basically harmless to most of the people, but it can be quite troublesome for some people. So these agents are called allergens, and when exposed to some predisposed person, it can cause allergy. These allergens are present in our environment. It can be indoor allergens, it can be outdoor allergens. Indoor allergens such as dust mite, which the baby plays, children plays. It can be a scented agarbatti. Uh, it can be a vary. It can be food allergen. Then it can be outdoor allergens. If the child is playing in uh, playing in outside, it can be dust mite allergen, pollen allergen. Uh, it is various type. So what we have to understand is in common skin allergies, what we see in our OPDs and what parents are facing problem. Uh, uh, Now I'm getting one question here from a parent. The question is, my 6-year-old has developed redness in the thigh area even after moisturization. How can I manage this? Okay, this is a nice question which I have got here. Basically, I was telling the common skin allergies can be various type. I will come to the question. It can be a contact dermatitis. It can be a atopic allergy. Uh, it can it can be a seasonal allergy. It can be urticaria, hives. So it can be various types. The presentation can be broadly classified as a child can present as a nasal complication such as rhinitis. Child can have conjunctivitis. Then child can have skin rashes, itchy, dryness of the skin. So it has a very signs and symptoms. Now coming to the question, what I have got here, a child has a redness over the thigh, which is present even after moisturization. How can I manage this? Okay. Now coming to this question, it basically shows that a child is having a time of a contact dermatitis. The child is having a redness of a particular reason. So first we have to look to the what is the triggering agent. Triggering agent, the child is causing this kind of redness, angles of allergy. Whether the child is having wearing a tight socks, tight underwear. Look after. We have to look the if the what kind of detergent, what kind of soap the child has been using. So we have to look after the reason for the this problem, and it's important that if we found out the reason and we try to work on that, even after that this problem persists, So it's better to consult a pediatrician or a dermatologist for this. This is important because we cannot ignore these symptoms, because in certain kind of allergic reaction which can manifest in a severe form, it can cause an anaphylactic reaction, which is a very fatal emergency. So we have not, we should not just ignore these simple signs and symptoms, because the manifestation of now I have got one more question. That is, what are the signs of skin allergies that I should look out in my 5-year-old? Yeah, that is what I was discussing. The signs of the allergies is varied. Basically, some of the parents which come on our OPDs, they have such a vast level of confusion that सर हमारे बच्चे तो दूसरे बच्चों जैसे ही खेलते हैं, बाहर जाते हैं, पर हमारे बच्चों को एलर्जी क्यों हो जाती है, सांस क्यों फूलने लगता है, हमारे बच्चे का स्किन में ये प्रॉब्लम क्यों होता है, क्या हमारा बच्चा दूसरे बच्चों से अलग है? तो it's such a confusion over the parents. Basically, what we have to understand, some children are predisposed to these things. Some children get exaggerated response over some allergens. So, looking for the signs and symptoms, some children can present just like a simple running nose, conjunctivitis, cough, just like a flu-like symptom. Some children can have these exaggerated allergic asthma-like episode. They can have on and off allergic reactions. Some children will have exposure to some allergens, chemical agents. They can contact dermatitis, which can be so much bothersome. It can be itchy. Looking out these signs and symptoms. Also, one of the most important thing around this thing, sign and symptom, we have to look in the family history as well, because some it has got a genetic predisposition. Allergens have children have genetic predisposition, so there will be some sort of family history. We have to look to maternal uncles, grandfather, grandmother. In parents also, there will be history of eczema, there will be history of asthma. So if we get such kind of history in the family, so we have to work upon that. So no, here I can get one more question. What precaution should I take to prevent skin allergies in my kids? Yeah, this nice question. This look, the treatment of allergy is not as a per se. It's it's a old concept. Prevention is better than cure. We have to look towards the allergens. We have to uh, uh, the triggering factor. The It can be a food allergens. The child may be allergic to some to be eggs, dairy products, fish. This is very common. This is very common. It's a pattern kind of thing where we can get a family history as well. कि हमारे बच्चे के चाचा है, मामा है, उनको भी इस टाइप की एलर्जी थी, एस्थमा थी. So child is get predisposed. Then there are children are allergic to certain drugs, amoxicillin group of drugs, some NSAIDs. The child can get allergic to them also, which has become quite common in our regular OPDs when we prescribe some medication and parents come back कि हमारे बच्चों को देखिए शरीर पे दाने हो गए, हमारे खुजली हो रहा है. So it's a signal that child is allergic to that specific drug. So in future we have to keep in this mind that whenever you visit the pediatrician or dermatologist, you have to mention कि look, हमारे बच्चों को last time ये drug दिया गया था and we had this kind of allergic reactions. So it's better to avoid those drugs. There are options, always options. One more important thing before going forward, हमें ये समझना, we have to understand कि the skin of children are totally different from skin of adults. They are more thinner. The skin is more thinner. The lipid layer, a kind of barrier which is in skin, which prevents infection or contact infestation by microorganism, is quite limited in children. So the uh, the products which are available for adults are not supposed to be used regularly in children. One more thing we have to understand ki the pH of the skin of human body since birth to second or third day of birth, it becomes acidic. That is, the pH is around 5.6 to 5.7 around. So whatever agent we are applying to the uh, to the baby, the detergent, the soap, the shampoo, the moisturizer, whatever we have using, we have to consider the pH. It has to be a skin friendly pH rather a neutral pH. The product should be dye free, should be odorless. So these are basic things we have to look to avoid these kind of episodes, uh, and can be it's a, look, allergies are exaggerated response of normal phenomenon. So we have to identify the allergens. We have to identify the triggering agents. If we do those things, most of these skin allergy we can easily control by home remedies. We have another question. How can I treat fungal infection in the foot of my 3-year-old? Okay, this is quite common skin problem with which children come to our OPD. Uh, foot fungal infection in foot. Basically, it is called tinea capitis. Tinea pedis. Sorry, capitis is the skull. Tinea pedis. Pedis. It is a fungal infection of the uh, finger foot. Look, a fungal infection is not a good thing. First of all, it basically shows there is something wrong with the nourishment of the child. Nutritional evaluation of the child is very important because a fungus is can be commensally present is commensally present on the skin, but when the child is immunocompromised, a child is nutritionally deprived, yeah, uh, so these commensal fungi can cause infection, and this fungal infection can be troublesome. It can spread to the other areas of the body or areas of the body. It can be a chronic infection. It may can last for longer time. So how to control this? First and foremost, personal hygiene is very important. You have to check whether the child is wearing wet socks, tightly fitted shoes, or the child is mm, what kind of detergent is the child is using, what kind of soap is he using. If all these factors have been eliminated, then we have to consult a dermatologist or pediatrician for this, because you cannot ignore a fungal infection. Then okay, okay, uh, we have the time is up. Okay, hello. Okay, I think we are time available now. I will give us some takeaway message, but we have to remember, just in a simple way, just remember one thing: the children's skin is different from the adult skin. We don't have to do as much thinking about this, but follow this basic principle. Use those products which are odorless, which do not have any dye, which do not have any precipitating chemicals in them. Use simple them. Keep the nourishment of the child proper, and try to consult the pediatrician or the dermatologist as soon as possible, because a simple skin infection can be a mirror, can be a sign of something, something a big systemic infection in the child. So it's better to consult a pediatrician or dermatologist if there is recurring or a chronic skin infection. Thank you. There are a lot to discuss. We will hopefully have another session.